Here is another skin tumor. You could see it is very intensely black, so you might suspect that there's a lot of melanocytes in this tumor. You notice that the surgeon has drawn a little oval where he plans on resecting this because he wants to get the whole tumor. He may or may not know what it is at this point, but in reality, in clinical medicine, when you see pigmented skin tumors, the question is this benign, or is this the most feared type of common skin cancer called malignant melanoma? Now, they have a whole bunch of little sayings and mnemonics to help you go differentiate one from the other, but don't learn them. Just understand from your own knowledge that malignant tumors are irregular. They may ulcerate. They become necrotic. They may be intensely black or they may not be. But the most important feature is how fast do they grow. Or if it was a little nodule that was present for zillions of years, what if one part of it or the whole thing all of a sudden start growing fast? That's the most important question. Let's put a microscope through this and see what it is. There's 3 types of common skin cancers: basal cells, squamous cells, and melanomas. And basal cells and squamous cells don't kill you because they rarely metastasize. Malignant melanomas are the only form of common skin cancer that metastasize very, very quickly and readily, and they can and do and will kill you, sometimes very, very quickly. Notice we have a normal epidermis here. Notice this whole thing is the tumor in question. Notice we have a hair follicle here and some skin appendages like sweat glands. And notice that these are the cells in question. So let's zoom in on them right away, and I want to show you something. See, these are melanocytes. These are like the melanocytes that you normally see in skin, but they are totally diffusely invading or buckshotting the skin. In addition, they are growing downward, so they are having not only a horizontal phase of growth, but a vertical phase of growth. And this vertical growth phase determines the prognosis. And Clark was a guy who gave one scheme for prognosis based on vertical growth phase, and Breslow was another, and Breslow's classification is better. Now, you know that these are melanocytes because not only do they look as malignant as hell, but you could clearly see that many of them have melanin in them as well. If you were to see a cell that only had melanin in it, you don't know that's a melanocyte. That could be a macrophage that has just eaten a melanocyte. But whenever you see a obviously malignant looking cell, and these are, because there's big, they have prominent nucleoli, which melanomas frequently do. They have abnormal and increased mitoses like there, and probably there. But let's take just one more second, and I know it won't be tough, to find 2 things. Number 1, an obviously malignant cell. And number 2, the fact that it has melanin in it. By definition, that's malignant melanoma, even if that was the only cell that you saw, or even if that was the only cell that you saw. Now, if that was the only cell you saw, you'd say, well, there's a lot of melanin there, but I can't really see the nucleus, and maybe it's a macrophage that just ate some melanin, so that's not a diagnostic cell anyway. Anyway, malignant melanoma looks like this. It has usually a big centrally located nucleolus, very big. It has abundant amount of cytoplasm. It's frequently pigmented, and the more pigmented it is blacker it is. And it may not have much pigment at all. It might not even look black to your eyes. And of course, it just invades all over the place. And we're going to back up here and show you how that, and not only is this invading the epidermis down here, here's a little artifact crack. It's also invading deep into the dermis. And This type of lesion could very easily have already gone to the liver or bone or wherever melanomas normally metastasize to, or lungs. And if you were a pathologist and you had a nice little, very accurate little ruler that you could put on your microscope slide, and you measured from the very top of the tumor to the bottom of the tumor, then that distance, maybe it's a millimeter or half a millimeter or a tenth of a millimeter or 5 millimeters, that distance determines the prognosis and the behavior of the tumor, or the vertical growth phase, or the thickest part of the tumor. The horizontal growth phase, or the amount of buckshotting it does superficially in the epidermis, is not nearly as important as the vertical growth phase, because once it gets into the dermis and the blood vessels, it could very easily metastasize, even though it's not very thick. This is the biggest killer primary skin tumor, malignant melanoma. Thank you very much.